Hey, everybody, it's Natalie Bencavanga, and I am here with my wonderful friend and colleague, Dr. Natalie Gentile. Dr. Gentile, thank you so much for being here with me today.
Thanks for having me, Natalie. It's always good to chat with you.
Oh, I wish in a way we were chatting about fun things. But girl talk nowadays really revolves around some heavy topics. And I wanted to have you on because there's so much going on in the realm of public health, both here in Pennsylvania as well as around the country. And I figured who better than a true healthcare disruptor like yourself to come on and talk about these issues. So, topics we're going to touch on today are going to include vaccine hesitancy and the reduction of herd immunity, what that means for you and your families. We're going to, of course, talk about what's going on in the Make America Healthy Again movement and RFK's impact on our public healthcare system. And speaking of healthcare, can we call it that anymore when so many people can only really access it when they're super sick? And even then, I don't know, because as insurance premiums continue to rise, more people are becoming uninsured just as they're pulling back on people's ability to access Medicaid and other forms of supplemental insurance provided by governmental assistance. So, to kick things off, before we even start, as a physician, let's take the temperature of the medical space right now. How are all of you doing and holding up? Because I don't think much attention is really brought on the impact that the negative rhetoric has on physicians themselves.
I think it's important to put into context where we have been in the medical field leading up to this point, because we've
Mm-hmm.
not been okay for a long time. Moral injury, also called burnout in healthcare, has been on the rise for many years. That's nothing new. With the increased administrative burdens and administrative oversight on physicians and healthcare workers, we are losing autonomy and ability to practice as we see fit and what's best for our patients. You add in the culture change when it comes to health insurance companies being so heavily integrated into how we have to practice medicine, we were ripe for already not doing great. And now we are facing significant challenges from the social media and media perspective, I think heavily influenced by some of the rhetoric that's out there about healthcare workers and about doctors in particular, and how our sick care or broken healthcare system is a problem, yes, but a problem caused by doctors. And I think that's where the disconnect is happening. So we are now facing even more scrutiny and I think demoralization.
Wow, you really just articulated that so well. And it was funny, Natalie, when you were talking about your industry and sort of how the blame has shifted, I couldn't help but think how parallel it is to what's going on in the world of journalism as well, right? We've also seen a huge problem happening with misinformation being on the rise, but also news deserts and how that impacts our democracy. But then also the blame being shifted to the journalist instead of looking at the billionaire class who now owns most of our entities. And it's very similar to the fact that insurance companies and pharmaceutical companies and large, huge, faceless conglomerates are now eating up all of our healthcare systems and how that's impacting us, and also how that bleeds into misinformation. And I wanted to talk about a few things specifically that I mentioned at the top. We're seeing a lot of misinformation, speaking of, and disinformation, which is purposeful misleading around the idea of vaccines. And at first it started with specifically a focus on the COVID vaccine and the dangers, the dangers around that vaccine or the lies that were being perpetuated. But now it's really expanded its way out to now really all vaccines. And there's been a lot of things that you've had to combat on your own social media in terms of myths around that. Can you speak to your concerns around vaccine hesitancy and how this could impact herd immunity and how it is already impacting our families?
So I think it's important to table set here just for background. I'm a family
Mm-hmm.
medicine physician. I am very engaged in public health and community health, but I'm also a mom of two little kids, right? So
Mm-hmm.
I can understand where a lot of people are coming from multiple perspectives. And I'm seeing a lot and hearing a lot. So where I have concerns around vaccine hesitancy is multiple fold. But number one, most of these vaccines are for diseases that we have not seen in a very long time. And so when I tell you that in my training, I have not seen measles, I'm not lying, right? And so I've not seen polio. And when we hear this rhetoric and messaging from the vaccine hesitant perpetuators that why would we vaccinate against illnesses that don't exist? I find that very concerning because the reason they don't exist is because of vaccines. And so we're kind of falling into this cycle of the reason that's not a problem anymore is because we've had a solution to it. And as we have more and more vaccine hesitancy and decreased uptake of immunizations for children, these diseases will come back. Now, why is that concerning? Well, there's the part of us in public health that find it important to take care of our neighbors, right? So, yes, maybe you might be a young, healthy individual who's not going to get severely sick from something, but there's probably a neighbor, family member, a person you care about, someone in your church who has, immunodeficiency problems, who's going through cancer treatments, who is not going to either be able to get this vaccine or is not going to respond as well to it if they got it because of their immune system. And so they are at major risk for severity of illness. So there's this lack of community approach to public health that I think is becoming more and more rampant, and I'm afraid of that. And I think a lot of it ties into our individualistic approach to health and well-being that we honestly, and we can dive into this more, I don't think we can blame people necessarily for feeling because of the sowed distrust in healthcare, because of the lack of healthcare, lack of access to healthcare has led people to say, you know what, I'm taking this in my own hands then.
Yeah. Yeah. Whew, you just said so many incredible things, Dr. Gentile. And if you're just joining us, I'm Natalie Bencivenga, and this is Dr. Natalie Gentile. You can follow us or subscribe to our Substacks here above. I heard a lot, but the word and the phrase that I think is really important that you brought back into focus is community. And the United States, we were sort of founded on this Wild West, maverick, rugged individualism. But the reality is that's not reality. None of us can build anything by ourselves. We all drive public roads. We all go and see doctors and have access to public spaces like parks and schools. And so nobody ever actually is alone, even though there is this mythology. And so I agree with you. There's been this breakdown of trust between the medical community and the community at large over many years due to a lot of misinformation, but also because of what you said around insurance companies moving more into the space of care. My dad used to say practicing medicine without a license, right? And so there's this now erosion, which has led us to this place where it's like, well, I don't care about that person. I'll be fine, which in fact, we don't actually know if you will be fine, right? Because disease can impact any of us. How do you deal with that? And I know that's probably a question bigger than any one person can honestly answer. But when we're looking at public health, when we're looking at community-based care, and you're also dealing with a culture of the individual matters more than the collective to such an extreme that we're literally seeing a reduction in herd immunity due to viruses that we've never, like you said, in our lifetime experienced. What do you do when you're working with a patient that's responding to you in that way? How does that conversation go?
So I think a big theme that I continue to see, and you and I have touched on this before in our personal communication, is dehumanization. And this dehumanization of fill in the industry. So I can speak to healthcare. There has been a depersonalization and dehumanization of patients and of healthcare workers. So people on both ends here in this relationship have been dehumanized. You are just a number on a chart, right? You are just the next person who's paying the insurance premium. There is a number assigned to you. You as an individual are not as important to this big corporate world. We in medicine are warm bodies, especially in the traditional health insurance-based, vertically integrated system where you've got health insurance in bed with the physician, with the pharmacy benefits managers, with the healthcare providers. Everyone's there seeing you, healthcare worker, as a warm body that can be replaced. And when we start to dehumanize people in this relationship from both ends, there will be distrust between those two entities, right? And there will be less communication. And so one way that I've tried to combat that is bringing the human being back into this. And that is both from my perspective as a physician saying, hey, I'm a human being. And this is how
Mm-hmm.
this looks in real life about how I practice medicine. This is how it looks to be have a family and own my own practice. And you, patient, are a human being, and you deserve validation of not only your symptoms and your concerns, but also your fears.
Yeah.
And having that human communication, I think, is something that we really need to get back to, because we aren't all going to agree on everything.
Mm-hmm.
But having trust is so much built on that human approach.
I love that. It's interesting because I see you and I follow you obviously on social media, on Instagram and all the spaces, TikTok, everywhere. And I think it's interesting because the more that you put yourself out there as a human being at first, and then physician, and then all the other incredible things that you are, I'm sure you get a lot of backlash. And I've noticed lately you've been more outspoken, especially in the space of public health and especially where it comes to RFK Jr. And so I'm curious as to why now in this moment have you decided to take this on? Because someone that has done this game for a while, the DMs can be a little rough. Okay. The comments can be a little scary. And I know that you're already experiencing a lot of stress and anxiety, but why are you so passionate in pushing back against RFK Jr. in particular, in the way that he is now running the CDC? What has you the most concerned specifically around policy?
For so long, we in medicine have seen people practicing medicine without a license, like you said.
Mm-hmm.
We have seen insurance companies tell us what we can and can't do. We have seen hospital administrators with no medical background making decisions for how we can and cannot practice and should or should not practice. And I'm tired of seeing people do that. And then now, what has really lit me up is seeing this now from the HHS perspective.
Mm.
RFK Jr. with no medical background doing this, the ACIP with people who are completely unqualified now leading, immunization decisions, the CDC, the FDA, all of these places where I, as a physician practicing medicine in the trenches
Mhm.
for so many years, went for guidance. I trust none of them now. And that scares the crap out of me.
Yeah.
And that scares our patients. And that scares my colleagues. And so that's why now I am choosing not to sit quietly anymore, because I feel this obligation to speak up when I'm sitting across the seat from people who are struggling day in and day out. These people's voices deserve to be heard, right? We deserve to be heard. And this is dangerous, what is happening in this administration, not from a political perspective. I'm talking from a leadership within these health advocates, people who are supposed to be advocates for us.
Yeah.
These health leading spaces are now nobody who knows anything about practicing medicine or actual health.
Mm. I respond immensely to specifically what you were just talking about, in the sense that when we're looking at what they've done, the trust erosion will go far beyond once RFK is gone. Will go far beyond this administration into the next or whoever's in charge. Because to your point, these were institutions that you could put your trust in regardless of who was in power, because they were outside of those partisan spaces. Their goal was to do the following. Now, of course, nothing is perfect and nothing lives in a silo. But I do think what concerns me the most hearing you is, if our physicians cannot trust these institutions, what the hell are the rest of us supposed to think? And so having people like you speaking out in these spaces is so validating, and it's so important and so impactful, because I think a lot of us feel truly gaslit around what is going on. And so when I hear a physician who is trusted in their space, has that authority in their space, saying, hey guys, no, this isn't normal. Hey, this isn't the way things are supposed to be. No, vaccines are safe. Or no, you can do these things, XYZ. That to me is wonderful that you're there, but also it's frustrating to me, Dr. G, because that just shouldn't be your job. Like you shouldn't have to carry that. And I think because everything has eroded so far, when you look at the future, let's say in a few years things look different, maybe. Do you think that's just magically going to fix how the public feels? Like, how do we get ourselves out of this hole? I mean, that's what I'm worrying about, is thinking long term here.
Certainly, this is not going to be fixed overnight. And frankly, this is a problem that did not happen overnight. This has been
Correct.
developing for a very long time. And now you see people who take advantage of this opportunity, and they're striking while the iron's hot, right? We have got, coming off of the pandemic, off the heels of the pandemic, we've got a population ripe for the taking when it comes to misinformation. One of the things that lights me up so much about MAHA and RFK Jr. is I am also a lifestyle medicine physician. I very much believe in the power of health, of wellness, of exercise, of nutrition. I very much believe in that. And those are things that are being talked about by MAHA supporters. And I do not disagree with some of that. Where I do disagree and have concerns is using lifestyle as a Trojan horse while you swoop around and dismantle public health behind the scenes, while you swoop around behind the scenes again, taking money from wellness influencers, right? Like that, and then blaming doctors for the poor health of our country. That, to me, you are distracting. You are using lifestyle, habit, and recommendations for evil. And you are using it as a way, not you, obviously, the MAHA movement and RFK Jr., using this as a way to distract us from the real things that matter, which is actual access to healthcare, actual access to safe food and drinking water, actual access to food we can afford, right? Which involves taking care of the people who are underserved around us as well.
That's right. And I just want to add a little something to that because I get a little perturbed on the face of it. I agree with you. Like, I'm the first person to say yes to a healthy lifestyle, quote unquote, yes to walks, yes to working out, yes to eating fruits and veggies. Former First Lady Michelle Obama wanted to institute an entire thing around eating fruits and veggies, starting a garden at the White House, having underserved and under resourced communities involved with where their food comes from, involved with a healthy lifestyle program. And the certain factions of this country really rejected that. We're very angry about that. Don't tell us what to do thing. And I find it fascinating that just a few years later, they're really on the flip side of this. So when it comes down to what they're actually hearing and who's delivering it, sometimes those things don't always align. And that's something just for people to think about. But I wanted to get to your point around access to care.
Yeah.
Because if we wanted to really make America healthy again, to your point, accessing quality healthcare in a preventative way, meaning you guys being the first sort of first stop on that way of, not being cared for. Primary care is so important. I wanted to just read this from Penn Capital Star. This will impact everyone around the country, but this organization is focused on Pennsylvania news. A combination of Trump administration policies will make healthcare coverage more expensive for people who purchase plans from health insurance marketplaces, and rural residents will be hit the hardest, according to a new analysis. Researchers from the Century Foundation say Trump administration policies, especially its refusal to ask Congress to extend the Biden-era tax credits that are set to expire at the end of this year, will boost out-of-pocket premiums, listen to this, by 93% in 32 states that allow the government to operate their Affordable Care Act, ACA, also some people call it Obamacare. New rules and tariffs will also have an impact. Rural county residents in those states will see an increase of 107%, while residents of urban counties will pay more than 89%. This is insane. About 2.8 million people who are enrolled in the marketplace in 32 states live in rural counties, including 776,000 adults between the ages of 55 to 64 and more than 223,000 children. 223,000 children, sorry. Point being, this is huge. So we're talking almost 250,000 children will be impacted, over 750,000 adults in rural counties alone. When you hear that, combining with all the other things that are going on, the lack of access that so many of us already have to just basic healthcare, and then hearing that premiums are going to go up over 100% for people in rural areas, which often are home to medical deserts, right? Like have the least access to healthcare, including maternity care. What goes through your mind?
A little disturbing, right?
Yeah.
This is catastrophic. This is catastrophic. I was just talking about this with a resident who's rotating with me. I have grave concerns about who is going to actually be able to afford insurance, period, starting in 2026, let alone access healthcare. So again, let's talk about what's come up to this point.
Yes.
Because rural settings alone are already struggling, as you alluded to. Hospitals shutting down left and right, being acquired by the big box health systems. That's happening regularly. Maternity care, absolute deserts of maternity care in a lot of these settings. So you already don't have a hospital for many, 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 many miles, for example, or clinics that are even available to take care of you. Now you're going to make it even more expensive to access it as well. What do you think will happen? If like paint this picture how this is going to go well. Because you've got people who most people are accessing their health insurance, for example, through their job. Okay. So now you've got people who are relying on businesses to give them health insurance. And these businesses are going to say, oh my God, these premium hikes, are you kidding me? How am I going to provide this for my employees? So that's at risk. So then you, individual, can't get it through your job anymore. So now you go into the marketplace. Well, you can't afford that one either. So now what? Okay, well, I guess I could just stop working. I could consider trying to go and seek Medicaid. Well, that access is decreasing as well, too. So where are we going to win here when it comes to accessing healthcare, when both the healthcare ain't there and then the way to afford it is being on the chopping block? To me, that's a recipe for big costs down the line. You want to talk about expensive? It's not preventive care, it's chronic disease management, which, by the way, is interesting because that's the line that they're chronically touting in MAHA about how at risk everybody is to chronic disease and how expensive chronic disease is to our country, and how people with chronic disease are lazy, how people with chronic disease are taking up all this access to healthcare and money. If you want to prevent it, then give them access up front on the front lines of medicine, and maybe that would make sense. But that would require actually understanding how healthcare works and thinking forward.
Those are things they just have no interest in doing. I don't know what it is. I remember when I worked in a women's shelter many, many, many years ago, and I was already very much all for finding ways for people to access healthcare through, learning about direct primary care from the model that you tout, having access to universal healthcare for catastrophic needs, of course, right? Whatever combination would work to make sure everybody could get whatever they need. And I remember the first time I was like really radicalized to this idea was when I worked in a women's shelter, and a woman came to me and it was like 11:30 at night. She said, my stomach is really bothering me. I'm in a lot of pain. And I said, oh my gosh, let's contact your physician. And she goes, oh, I don't have a doctor. And I said, oh my gosh, okay. Because she was like doubled over, like the woman was in pain. And I turned to the woman that ran the place and she said to me, send her to the ER. And I said, but it's a stomach pain. Like it could just be like anything. Like send her to the ER. We always send everybody to the ER because they have to take care of them. Because none of these people had health insurance and none of them qualified for Medicaid. So I remember in that moment, I thought, well, this is so stupid. Instead of being able to just talk to a doctor, her doctor, and probably troubleshoot, and or if the doctor then said, this is a real thing, you need to go, or, oh, this is just gas, like here, whatever. Instead, we were going to send her to the ER, which was going to cost thousands of dollars that the taxpayer was going to have to pick up, when it could have been just easier if she had access to healthcare. That was my first moment of realizing, oh my God, this system is totally messed up. Like, what are we doing? And now, and that was a Reagan era thing, by the way, for people, just to be clear, that you have to treat people that come into the ER. That was under a Republican president in the 80s. And while it's important that we have it, it was never meant as everyone should just go to the ER then. It was meant as a, last resort. We have to take care of people regardless of their insurance status. So to your point, I bring that up because one, this problem didn't happen overnight. But two, when people don't have access to basic preventative care, they have no choice but then to access the catastrophic healthcare systems that we have that are not in any way set up to handle the influx of people coming in at 11:30 at night for a stomach ache. And so it's just wild to me that this administration and whomever comes next is going to look at this issue and say, this is fine, we don't need to solve it. I mean, on what planet? On what planet?
Right. I think there's been a huge, I've noticed this big shift. And I think a lot of it started in the pandemic where people weren't even going to the doctor, right? Or
Right.
preventive services just weren't being accessed at that time. And I remember this shift now where everything feels like an emergency nowadays. It's like people have lost the ability to trust themselves, to trust their bodies, right? They've lost because they can't talk to someone about it. So they go on Instagram and like an influencer talks to them, or they Google it instead, because God forbid somebody actually answer their message from their doctor's office. They don't even know who their doctor is, right? Like this is so multifactorial that it has led to people feeling like everything's a fire drill.
Yeah.
And then where do you go for that? You use the emergency department for your primary care. Which is a completely inappropriate use of resources, incredibly expensive, and frankly, very dangerous. Because I'll tell you this much, you go to the emergency room, you are being ruled out if you're dying or not. And that is the ultimate goal there. And they do a damn good job over there. But they are not meant to do primary care. That's not their job. So who's following up on it then?
Right.
Who's following up down the line? You still have an access issue. Right? And it's scary because there are true emergencies that come into the emergency room. And if we are using those sort resources for non-emergencies, you better hope someone is available for you then when you have some type of trauma.
Yeah.
Traumatic event in the ER.
100%. And I think that these are the kinds of conversations I would love to continue to have with you. Back in the day, you guys, and thank you everybody that's joined us. I'm Natalie Gentile and I'm with Dr. Natalie Gentile. It's just a fun coincidence that we're both Natalies and both outspoken on various topics. And that's why this is so much fun. But back in the very beginning of the pandemic, we met through a mutual friend of ours, Tony Norman, who sometimes watches these. So if Tony's watching, hey, Tony.
Hi, Tony.
And we started doing a show together called What's on Your Plate? And it was really focused on what was just on our plate as women and in our respective spaces. And it was meant to sort of support people during the lockdowns, et cetera. And then we kept it going for a while after. And I think now is the perfect time to start having these kinds of conversations again about what's not just on our own plates, but really what's on the collective plate. Because the truth is, America does not have a healthcare system. We have a sick care, barely, system that so many of us can't access. But there are so many things that are happening from a public health perspective, from a wellness culture perspective, that I just can't imagine talking with anybody besides you. And so I would love to be able to continue doing these more regularly and really dive in to a lot of the topics that are impacting us societally and also as self-identified women as well.
I'm here for it.
I love it. Any other thoughts on things that you are seeing or concerned about as we move forward? Or anything that you would like your audience to know?
I think keep a finger on the pulse of who is now being put in certain leadership positions. So things to pay attention to are the ACIP, which has to do with our immunization protocols and recommendations. And keep a finger on the pulse of who's now, directing at the CDC and at the FDA. Because I think this is a fascinating shift where people completely unqualified for their positions are now in these positions. And this will have huge implications for public health. So I think just starting to be aware of that is a very important way to be an informed citizen.
Thank you for that. If you're not following Dr. Gentile, please do on both Instagram and TikTok, Natalie Gentile, MD. She is always popping off with some really good commentary and, more importantly, some impactful information that you need to know around your body, around wellness, around the industry of wellness, and of course, around public health. So I always appreciate your insights and your evidence-backed information that you provide in a nonpartisan way. And I think that's an important thing to discuss here as well. Healthcare should never be a partisan issue. Everyone deserves access to quality, affordable care. And that's the kind of conversation I want to continue having because we are all impacted by the choices being made, not just with this administration, but with all administrations, right? Like you said, these problems didn't manufacture overnight. They're being exploited, but they weren't manufactured overnight. So I think we want to keep that in mind as well. The solutions are going to be multifaceted and bipartisan at the end of the day. So thank you so much, Dr. Gentile, for being in conversation with me and for sharing what's on your plate. I'd love to do this again in a couple of weeks and continue on. And before we leave, we had a comment here from Rich. He says, thank you both for your discussions. I think this is an important thing that needs to be discussed more as well. Well, we agree, Rich. So we'll be back.
We're here for it, Rich. Yeah.
That's right. Thank you again, everyone.
Thank you.
And as always, please take care of yourselves and each other. Bye, everybody.